Hey everybody, it's Craig from the University of Applied Research and Development. It's our privilege to have with us Dr. Karen Blackwood, who's from the Intermountain Center for Disaster Preparedness. Hi, Karen.
Hi,
So good to have you with us. Thanks for making it.
thank you for inviting me.
Oh, look, we're honored, and you've had such a big experience being with a range of different agencies, including the Navy as well. And so I'd love for you to just tell us about your role and what you do.
Well, I currently am the director of the Intermountain Center for Disaster Preparedness. We're part of Intermountain Healthcare, which is the largest healthcare organization in the state of Utah, with hospitals and clinics in some surrounding states as well. My role currently at the ICDP is to oversee the programs where we provide training and education for whole community readiness, including healthcare. We conduct research because, of course, anything you train on needs to be the best practices, the most current information out there. We help with planning and assessments, doing those risk assessments, making sure that we are truly ready. And then we conduct exercises, disaster exercises.
Wow. And so when you work with communities and you do the training, are they exercise-based or are they theory-based?
Well, we try to limit theoretical because we need everything to be very applicable. It's not enough that we sit people down and
Yeah,
we just regurgitate information and we feed them
yeah.
in this didactic way. It's got to be applicable. They've got to get their hands dirty, basically. So really everything that we do as far as training, it includes some application process, whether it's a skill station where they go around and practice something, or it's some type of an exercise where they have to apply what they've learned.
Okay. And has this always been of interest for you, working in community and doing training and research?
Oh, I've been in emergency management for years and years. Before coming to Utah, I did run the US Navy's emergency management program in the Western region, basically. And before that, I worked at the community level, at the county level. So it's all I know.
I think on your profile, you've worked with the Navy, Homeland Security, a range of other organizations. So why don't you share some of your experiences for our students and the people watching?
I think one of the things here in the United States, we have defense support to civil authorities. And I think that that's one thing that communities don't quite understand is the role of uh, the Department of Defense and the military when it comes to large-scale disasters. They don't come in and take over, but they're a huge resource, but it's very specific where occasions where they can come in. They can't just come into a local community and start taking over. No matter what movies say, things like that, it just doesn't happen. And in my role now with healthcare, we sort of run into that same thing because the different hospitals, and Intermountain Healthcare has many hospitals, but even our partner hospitals, they look at how they would evacuate during a disaster. How do you get patients out of a geographical area when something bad happens? And many of them, they think, well, we'll just call the National Guard or we'll call up and we'll use helicopters and stuff like that. And I'm like, you can't do that because everybody's going to be expecting to use the same resources.
Right.
So I think it's important to understand that, there's a connection there, but they don't just come in, and take over and solve all of our problems. It's definitely got to be a partnership.
And why is that? Is this because there's the division between the military and civilian authority in a local area?
Oh, absolutely. Here we have restrictions on what the military can do within the United States. It's not war fighting, so they have a very limited role, but they come with a lot of resources, very expensive resources to be used, and so we need to make sure that they're the last tool that we call on, and we utilize our partner agencies, our local community partners, as well as even state to state assistance. We have the Emergency Management Assistant Compact, where we can go to other states and ask them for resources. And so I think it's just understanding where we can pull resources from, who we can ask, and then prioritize them accordingly.
How does that work best when the civilian organizations and a military organization are working together? There must be challenges and maybe misunderstandings at times. What's the best way to make that work well?
Oh, I think speaking the same language helps a lot as far as incident management. We use the instant command system,
Right.
and even the military. That was part of my role within Navy emergency management, was getting people up to speed on the instant command system, so that when larger resources, even other federal resources come in to a local community, everybody's speaking the same language. We know, and that's the only way that we're going to be able to merge together during a large scale disaster and be able to respond effectively. Knowing that, I think everybody that gets into emergency management or into some type of first responder role, you're a bit of an adrenaline junkie, maybe a bit of a type A personality, just a little bit. And so understanding that other people have that same personality type, and just being able to work with, and come together seamlessly. I tell people all the time, there's no competition during a disaster. Whether
Right.
you are a competing healthcare or a hospital, from the one I work for, during a disaster, there is no competition. It's all for what's best for the community. And frankly, you don't want to be the one in charge during a disaster. Just do your job and get through it, and make sure that you're doing what needs to be done, and don't try to push yourself to be the person in charge, because that's where everything is going to land. But I think it all comes down to communication and coordination.
That's fantastic. So, Dr. Karen, you did your PhD. What in? Tell us about your PhD.
My PhD is in Fire and Emergency Management Administration from Oklahoma State University. It's not it's an interdisciplinary PhD, so it's not a sociology degree or in any specific field. It's a field all in of its own. My dissertation was on the willingness of nursing students to respond during disasters, because again, that's an untapped potential resource
Wow.
that people don't call upon. When you have thousands of individuals going to school, but they have some type of basic knowledge that could be applied. So that was actually my dissertation. But yeah, it's Fire and Emergency Management Administration.
And was there a willingness from training nurses to respond?
There is a willingness. There are many factors that can influence their willingness to respond, depending on if they have children or dependents that they have to take care of. And there's a difference between being willing to respond and being able to respond, because you might be willing to respond and have all that altruism and really feel like, yes, I want to do what's right, but you don't have a vehicle, or you can't actually get to your hospital or your facility. So there is that difference. Some of the barriers was having dependents not quite knowing what needs to be done, which is where my organization comes in. If you don't know your roles and responsibilities, or even what you could offer during a disaster, then you're not going to be very confident in how you would respond. So increasing that self-efficacy, so people feel like, yes, I can do this. Those were some of the things that improved their willingness to respond.
So your findings from your PhD and working with nurses and them being included into a response to an emergency or a disaster, how has that impacted or changed the way that you do your role?
Oh, I think that it's how we do our role. Even before we get to the training piece, I think it's important that facilities, hospitals, develop a plan, a valid plan, one that they've actually gone through, and one that is comprehensive enough so that when we ask somebody to do something, it's based on our response plan, on what our strategy is. We're not just saying, okay, well, this time you're going to do this job, and the next time, you as a nurse will do this job. But giving them their roles and responsibilities and setting expectations because then once we have that plan that does that, we can start training and then exercising to it, which through training and exercises raises their confidence in their ability to perform the tasks that are assigned.
Right. That's great. I often find when people do their PhD, sometimes there's a disconnect when they suddenly get their first role. Obviously, you didn't get your first role because you've been in the industry for a long time, but often that PhD gets done, the box is ticked, and then it goes on the shelf, and then it's not looked at again, and there's no practical application of it. So did you look for opportunities to share the findings of your research once you'd completed your PhD, to share it widely?
I made it available for free, for people who wanted to take
Mm,
a look at it. I work with my organization works with nursing schools here in the state of Utah. We do different trainings for them.
right.
So making it available so that their professors, their instructors, understand uh, maybe what's influencing them and what might need to be focused on during their training so that they come out in the end of nursing school with some basic foundation knowledge of disasters. Because right now, in most cases, it's not part of the curriculum. We're not teaching them really anything about disasters. They're learning
Wow.
anatomy and physiology. They're learning their competencies as nurses, but not what their role might be during a disaster.
Right. Right. It's a bit of a gap, isn't it?
It really is, especially with COVID and all of the
Yeah.
other things that go on. And healthcare workers have a very specific skill set that is absolutely critical during a disaster. When
Mm,
you either need to continue caring for people who are already in the hospital. You can't just kick them out of the hospital. They're sick. Babies are still being born. People still have
mm,
heart attacks. And then you have the victims from being injured or whatever it is that's going on in the disaster. So we have to make sure that people are well trained and confident in their requirements so that we can continue to provide those services.
right. You just mentioned COVID. So how has your role and your department, your team changed what you do and how they do things due to COVID?
Well, we're not operational based. So the hospitals have
Mm,
emergency management personnel. They have someone sort of guiding them and helping them develop the plans, which were in place before COVID. Our role has been more of trying to determine exactly what training is needed now
right.
that because of COVID. Everybody
Mm,
will say, oh, we need training. Well, yes, but exactly what kind of training do you need? It's not,
right.
we don't want to take up more time when we're still caring for patients and we still have this going on. So trying to figure out exactly what kind of training there is, but there is more demand. People do want to understand, not just for a pandemic, but we're in a very high earthquake area here in the state of
Mm,
Utah. So, what happens when there's an earthquake? And what happens when there's an earthquake, as there was in 2020 here during a pandemic? And then you have the civil unrest that was going on at the same time. So, how do you manage those multiple things that are going on? So, I think figuring out the best way to what training's needed, what people need to know, and then how to deliver it when you can't hold in-person classes and that type of thing.
mm. So obviously, everyone has become more fluent with using video conferencing, using a lot more technology. Apart from video conferencing, is there a technology that you've integrated into what you do and how you do it that you didn't use before? How has technology helped you during this time?
Well, I would say things like Zoom or WebEx, Microsoft Teams, anything that provides this virtual capability has really changed our operation because now it has broadened to where we have people from across the United States coming to our trainings instead of just Utah or maybe our
Mm,
surrounding states because we're offering this way. In moving forward for my organization, we're going to offer hybrid courses where you can
mm.
come. We have a training facility. You can come here if you want, but it will also be offered virtually so that those who are interested outside of the area can still participate.
Right. Have you had not just using the technology, but have you had to train people to interact differently in a virtual setting than being in person?
Well, I've had to learn to because I am I'm big on expressions. I can read body language to tell if people are getting it or that
Uh-huh.
means something to me. And when you're virtually and somebody shuts off their camera, but they're still on, I miss that. I need that in order
Mm,
to be able to deliver effectively. I need that, nonverbal feedback. And
mm,
my organization, we're located inside of an operating hospital. And during the height of COVID, we weren't in the office. From March of 2020, we worked remotely until the beginning of July of this year, where we started coming back into the office. And I had to learn how to work remotely. I don't like it. I like interacting with people. I need that type of thing. So I think learning how to work more independently and still feel effective was something that I had to learn, and my team needed to learn, and then just how to make the technology work the way we need it to, whether it's breakout groups or it's not just that chat feature that these systems provide, but really utilizing them as robustly as we can.
I often found, even with our own students, when we moved into a breakout room, there's a lot of fear and worry that they'd get lost.
Yes.
And be able to make their way back.
Come back, yes. Yes.
So Karen, just in the few minutes that we have left, if people wanted to do your job and be in your area, what would you suggest that they do in terms of training and professional development and experiences to prepare themselves to do your role well?
That's a good question. Seek out, it's not just education, but it's gaining some experience, whether it's volunteering with a nonprofit organization, just so that you get some type of experience during disasters, helping. So I think experience is extremely important. Seeking out opportunities for different types of training. If you wanted to do my specific role, become familiar with healthcare and a healthcare organization's role during a disaster and how those partnerships work, how that coordination works. I think that would be another important piece to it.
Right.
And familiar with adult education would be another one.
Adult ed, okay.
Yes.
You mentioned that when the military comes in and civilian organizations have to work with them, having that common language is important. So do you think if someone wants to work in, say, healthcare, they need to be familiar with that industry, or they want to work in a different area, they have to know the actual industry?
I would say absolutely yes. If you wanted to work in the private sector, say for a utility company, doing their emergency management or their emergency planning, you would need to be familiar with the utility industry, because that's the only way you're going to understand the role of your organization when it comes to a collaborative response. You can't start planning if you don't understand what your organization's bringing to the table and what the expectations are for your organization.
Yeah, good. Yeah, that's a good understanding for people to understand the industry, and not only the emergency management language, but also the context that might operate in.
Absolutely.
Dr. Karen, I really want to thank you for your time. I know you're very busy, so thank you for sharing some of your experiences and some of your learnings and ways of working. I really appreciate you being with us here today.
Oh, it's my pleasure. Thank you.